Developing tonight, the Johnson & Johnson vaccine on pause. The company also stopping all vaccine clinical trials for the time being. This comes after 6 women developed blood clots within 2 weeks of getting the shot. One person died, another is in critical condition. The CDC is scheduled to meet tomorrow to discuss the cases.
Experts say the blood clots are extremely rare. To put it into perspective for you, there are only 6 reported cases out of nearly 7 million J&J doses given. But some are concerned this could deter people from rolling up their sleeves. Fox 35's Lara Greenberg joining us live tonight with that part of the story. Good evening, Lara.
Good evening, Luann. You know, vaccine hesitancy has already been an issue, a concern for health experts even before all of this. And now there are worries that with questions about the Johnson & Johnson vaccine, even more people will be hesitant to get vaccinated. Mo says the things she's seen online about vaccine side effects is all she needs to make her decision about getting vaccinated.
I've been just seeing like a lot of people with the negative reactions. And so I guess since it's still in like the testing, you know, like the first couple years of it, I think I'm going to be okay without it.
And now with the FDA and CDC hitting the pause button on the Johnson & Johnson vaccine for possible risk of blood clots, she feels even more assured in her decision.
If they put a pause on it, then that's a sign already that it's not a good idea to rush it out.
Health experts say they understand why this kind of news would make people hesitant.
Hesitancy when you hear something like this, that there is this rare clotting disorder, you know, that's substantiated, that's warranted. They deserve the right to know that the vaccines that they're putting in their arms are safe and effective.
But epidemiologist Dr. Jason Salemi says that's why the vaccine is on pause. He says this news shouldn't make people more hesitant about getting vaccinated, but should actually make them more willing to trust that the government and scientists are doing everything they can to get this right.
There's never zero risks associated with anything. But if you balance everything out and look at the benefit versus risk, I still think it's largely in favor of getting vaccinated.